How do you fight endometrial lung cancer? But I think you're asking endometrial cancer that has metastasized to the lung, because endometrial is a distance away from the lung. Coming from endometrial cancer that was removed in 2012 from a total hysterectomy, do you fight it with hormone therapy or chemo or what? It's not a question I can just answer real simply on a holistic health hour here. So you need to, work with either our clinic or a clinic that's going to treat you as far as looking at your whole picture. So if you have endometrial cancer that was treated in 2012 and now it's metastasized to the lung, and how would you know that? Is if you have lung issues and they see a mass, they do a biopsy, and it's actually endometrial cancer in the lung. So lots of times people will realize that when you have metastasis of a cancer to another spot in the body, it's still that same cancer. So how would we treat that? Again, we don't treat cancer, but we treat the person. And how would we care for somebody with metastatic cancer? Is we certainly use Rife technology, and we'd use nutrition and diet and work along with your oncologist if you're going to be working with an oncologist. Can you use hormone therapy? Well, if it was estrogen receptor positive or progesterone receptor positive or HER2 positive in the first place, and they did another biopsy of this one, they should be checking whether it's hormone positive or negative with this one, because just because it was with the first one does not mean it is with this one. So hormone therapy might have no effect on it. Would you use chemo or what? Possibly. It totally depends on the person, depends on what's going on. I just can't answer that. And I'm not a practitioner that is completely against chemo. I think you should be doing other things as well.